All right, today we're going to be talking about the pathophysiology of leukemia. Leukemia itself, for you to understand it properly, you need to know that the blood contains three types of cells. So these three types of cells we know to say it is red blood cells, white blood cells, and platelets. Now each type of these cells have a specific function in the body. For example, red blood cells carry oxygen from the lungs to the rest of the body. When you look at white blood cells, they fight invading organisms such as bacteria and viruses, and many others, of course. When you look at platelets, these are involved in the process of blood clotting. Now, bone marrow, all these cells, they form a soft tissue that is found on the center of the bones, and this soft tissue, we commonly call it as bone marrow. So in this particular case, you'll find that from the cells developed from, and you can have a red blood cell developing from a stem cell. The white blood cell, or the platelet, developing from the stem cell, and of course the development of these cells type produce each type of red blood cells coming from stem cells. And stem cells have certain effects on the body, especially in leukemia. The first thing is that the one white blood cells may not mature properly as they develop from a stem cell. As a result, they may lack the habit to kill foreign bodies in the bloodstream. Apart from that, again, you may find that this defect can now seriously damage especially in leukemia. And you may find that this defect can now seriously damage the immune system such that the body loses the ability to fight off infections. Then the other thing is that, again, as white blood cells develop from the stem cell, there may be many white blood cells that may form as a result from these white blood cells that may form. They may end up packing the bone marrow until there is not enough room in the red blood cells and platelets to develop. And when this happens, you'll find that the body will have lack of red blood cells, and there will be not enough oxygen reaching the body cells, and other recurrent infections is present in leukemic cells in the body and may cause an overproduction of these leukemic cells, which end up outnumbering the normal cells. And when this happens, now you see there's a recurrent of infections. So you'll now see that the patient has leukemia. They have frequent infections because the immune system is low. Apart from these bleeding tendencies or disorders, the reason is because the body is lacking platelets to facilitate clotting mechanism and other anemic symptoms. This patient again may present with anemic symptoms such as fatigue, dizziness, cyanosis, and many others. Of course, because the body does not have enough red blood cells, and the reason is simple. The body is in leukemia, simply the body infected by leukemia produces a lot of white blood cells which are immature, and they don't differentiate because what they should have been. Then of course sometimes you may also say that in leukemia, or leukemic cells may accumulate in certain parts of the body, and this causes pain as well as swelling and affected body structures where these leukemic cells have accumulated. So in short, this is a disease progression of leukemia as a pathophysiology. Now, labs and diagnostic testing, complete blood count. A CBC is a diagnostic test that measures white blood cells, red blood cells, and platelets, along with HGB, hemoglobin hematocrit levels in the blood. Abnormal levels of white blood cells or abnormally low levels of red blood cells or platelets may indicate leukemia. People with leukemia can have a very high white blood cell count, sometimes in the range of 100,000 to 400,000. Another lab or diagnostic testing is bone marrow biopsy to measure the amount of overcrowding that is caused by the white blood cells. A specialist uses the needles to extract a simple sample amount of bone marrow, usually from the hip bone, the iliac crest, to check for leukemia cells. Leukemia is a cancer that starts in the bone marrow, and this test can help determine the type of leukemia the patient has. Lumbar puncture or spinal tap. A small amount of CSF, cerebral spinal fluid, is removed from the space around the spine and is examined under a microscope to see if cancer has spread to the spinal fluid. Now, treatment. Treatment types of leukemia leukemia, the type of leukemia, age, your treatment of leukemia general, health, or whether cancer has spread to other parts of the body will determine the treatment options. The treatment options are as follows. Chemotherapy, which is used to kill cancer cells and stop their growth. Radiation therapy, use of high energy radiation to target and destroy cancer cells. Targeted therapy, drugs that are specific target cancer cells without harming the normal cells. Immunotherapy, treatments that boost the body's immune system to fight the cancer cells. Stem cell transplant, replacing diseased bone marrow with healthy stem cells. Surgery, which is rarely used but may be an option, remove a large spleen or lymph nodes that are infected by the leukemia.